Hello fellow Earth residents, I hope everyone is doing extremely well. Welcome to the second part of hip surgery and skiing. If you missed the first part, check that out so you can understand the progression in information presented. In this part, I wanted to talk about how hard it was to get diagnosed and why I finally decided to go for surgery and how I knew when surgery was the right option for me. You have to know your body to make your decision, but hopefully my process can help you understand how I reached my conclusion. When I went to the physio for the first time in early December 2018, I told them all the pains and the symptoms. They have specific tests for hip impingement and different hip problems like flexor strains and so on. The strange part for me was they could never replicate the pain I had when I skied. Through all the flexion ranges and internal and external rotation ranges, I wasn't symptomatic in the physio room, which over the course of the season was obviously frustrating for all of us, as it always seemed like a little bit of a mystery, never 100% certain what it actually was. They assumed it was FAI, as I did show I had slight impingement, but no pain presented while I was in the impinged range. This is generally pretty strange. Usually when you put people in the ranges damaged, you get pain. Then you know what movement creates the pain, then you can assess where the damage is, and then a physio can accurately diagnose the issue. The diagnostic tests the physios do are generally highly reliable, and it is something I always recommend, and still will recommend as a first line, as they can understand by feel what an MRI can show. I mentioned after a few sessions that I wanted to get an MRI to see what it was actually, but they told me that even if I get an MRI, the treatment will be the same, which was physio and glute strengthening exercises that they had given me. They told me hip surgeries were not really successful and shouldn't be an option, so knowing the structure of my hip isn't important. In my personal experience now, it wasn't 100% accurate for my case, but exhausting pre-surgery options is essential, I still believe, and the information they gave me, I do believe in. There is, however, a threshold of understanding your own body to know when things are not getting better and being able to judge when to move to the next step. After a few weeks of pain, I called my osteo in Australia and told him the symptoms, and straight away he said, "You have a torn labrum." He did recommend I go get an MRI, so I went off to the hospital and the next week was able to get an MRI. I'm in Japan, so that was definitely an experience. The MRI came back with no abnormalities. The season stretched along for another month and the pain was still there every day while I was skiing. I was doing physio every week, every day, all the exercises they gave me with no change. So I saw a local osteo that said I might have an inaugural hernia and I should get an x-ray. So I went to get an x-ray and this also came back with no abnormalities. Definitely no hernia, which was good, but also bad as I was still in the dark as to what exactly was the problem. These no abnormalities I will find out later in the year was due to the lack of adequate professional training in the Japanese healthcare system. They sent my x-rays and MRIs to Sapporo University Hospital and Tokyo University Hospital to get a second and third opinion, all to come back with no abnormalities. Anyway, this is now mid-February, pain still present, MRI and x-ray negative, physio isn't 100% sure, the test every week are non-symptomatic with a non-pain FAI. My osteo is sure, but I'd only chatted with him over the phone, so I'm not sure of him because he hasn't seen me actually in person. I was at a bit of a loss and I felt like maybe this was my life now, and I just didn't enjoy skiing. Usually all my spare time is spent skiing and every bit of spare time now is spent laying in bed. At the end of the winter I returned to Italy and I saw a hip specialist surgeon there, and he looked at the MRI I had from Japan and said, yes, you have some degradation in the labral area and it is a slight possibility you could require surgery for this. But he said, I want you to do physio for the next 2 months to see if it improves now that you're not skiing and it's the off season. I didn't ski for 2 months, did physio 6 days a week and it got worse. So I went and filmed with Paulie and Richie, the Legacy movies, after 2 months off skiing and I was still having pain. By this stage, I had to go back to Australia and started the whole finding a specialist process again, which in Australia is an even longer process, and I was finally recommended to someone who I felt was amazing. I felt like he really cared, maybe he didn't, and he's just a good actor, but he looked at my x-rays from Japan and said, yep, you need surgery, and explained simply in a way I could see all the problems. I was thinking in my head, this is not hard to see at all. how did the guys in Japan miss this? He said, you have a torn labrum, FAI, and the start of osteoarthritis, as you have a bit of bone on bone in this certain area. By this stage, it was the last week of July, and he explained the recovery period, so I decided to have surgery the next week to try and save the Northern Hemisphere winter. After this process, I do feel it was necessary to go through, preferably with one specialist, but don't be afraid to keep searching if things are not getting better. But I do think trying to exhaust pre-surgery options is essential, because maybe you could be that person that doesn't need surgery. But it got to the point for me that things were getting worse and not better, and it was important for me to move to plan B. I'm someone to stick to a plan. I worked hard every day on all the exercises the physios gave me. If you really do everything to 100% and it is getting worse, that for me was the final decision to go for surgery. But I do think if you know deep down you haven't been putting in the work that the physios give you, then surgery shouldn't be the option straight up. I did about 8 months of physio, and for me that was enough time to know. Anyway guys, I'll talk about the surgery and post-surgery process in the next video, so stay tuned for that. If you haven't, subscribe, like, and hit the notification bell. Until next time. If you'd like to learn more and improve your skiing, I highly recommend you head over to the Projected Productions website and sign up for the All Access Pass that has 7+ hours of ski instructional material from the world's best ski coaches and instructors.